Good morning. My name is Anita Davis, and I'm here as the spokesperson for the United Healthcare Workers of Ontario. We represent over 3,000 Ontario frontline healthcare staff, including nurses, physicians, paramedics, administrative, and support staff from 50 regions. We have grave concerns with respect to the termination and unpaid leave notices resulting from the various vaccine mandates. I myself am an RN here at the LHSC with over 31 years of experience. You cannot replace those years easily. I've been given my notice that I will be terminated tomorrow at midnight because I choose not to vaccinate. This, of course, is a hardship for my family, but I am only one of hundreds of healthcare workers at LHSC and St. Joseph's Healthcare here in London who will be terminated. Can you imagine the full impact, not just on London, but our entire province? Before the pandemic, LHSC was already short more than 100 RNs alone. Imagine the staffing shortages after the terminations. Premier Ford himself acknowledged that 15% of Ontario's healthcare workers remain unvaccinated, putting the potential magnitude of staff losses in the tens of thousands. The provincial government is now risking the complete collapse of the healthcare system. Practically speaking, what does this mean for patients in Ontario? It'll mean even longer waiting times in the ERs, as well as for surgeries, tests, and appointments. The current backlog is daunting, to say the least. And what about our rural hospitals? What about our long-term care centres? These staff members are exhausted and stretched beyond their limits now. We've all heard the stories of the rotating closures of ERs on weekends and grossly understaffed nursing homes. The situation may become catastrophic as our flu season approaches. Directive 6 directs LHSC to test me, not to terminate me. Testing is the only differentiating factor between myself and a staff member who chooses to vaccinate. We both continue to use all the infection control protocols already in place in our system. And this is a system that works and provides exceptional protection. All Ontarians should feel confident that they are safe going into any of our medical centres. I'm asking you, Premier Ford, Minister Elliott, and Minister McNaughton, I want you to do the right thing. Keep our hospital staff heroes working. Allow them to make their own informed choice while following all safety protocols that have been in place since the beginning of the pandemic, so that your citizens can continue to get the health care that they need. But under no circumstances, please do not risk the collapse of Ontario's healthcare system because of suspensions or terminations. Now I am pleased to welcome a friend and a supporter, MPP Roman Baber, to bring some remarks. Welcome, Roman.
Good morning. I'm MPP Roman Baber, coming to you from beautiful Victoria Park in London to the sound of bells ringing. I'm honored to be joined by dozens of London nurses and other health care workers. In the last 19 months, we've come to rely on them as they shouldered the burden of the pandemic in what was already an overstretched healthcare system. That's why I'm distraught and saddened that many of the healthcare workers joining us today, along with many of the 3,000 Ontario healthcare workers represented by the United Healthcare Workers of Ontario, will be terminated at midnight tonight. Thousands more will be terminated by November 1st because of their personal medical choice. In the last few months, I've been advocating that we should not force healthcare workers or any Ontario employees to choose between their personal health and ability to put food on the table. It's cruel, unnecessary, and unbecoming of a free society. Choice should not lead to unemployment, and choice should not lead to the collapse of Ontario's healthcare system. Last Friday, Premier Ford recognized that close to 15% of Ontarians' healthcare workers remain unvaccinated, and that mandatory vaccination will result in the loss of tens of thousands of Ontario healthcare workers. That would be a disastrous and unacceptable situation. Ontario has been suffering from chronic staffing shortage for years. Indeed, the government campaigned on hallway healthcare and attributed capacity challenges during the pandemic to staff shortages. We're already seeing dangerous trends all across Ontario. Here in London, the intensive care unit recently closed an entire bay due to shortage of staff. Ottawa's regional trauma center is periodically unable to admit patients. Guelph's labor recovery unit is often closed due to shortage of nurses. In Central Ontario, the critical care unit has been operating with 55% of the required nursing staff. In Toronto, elective surgeries are being cancelled because there's not enough staff to provide clinical care or sterilize the equipment fast enough in between surgeries. A loss of tens of thousands of nurses and healthcare workers will lead to the collapse of Ontario's healthcare system, wait times, delayed surgeries, and most certainly, lives lost. While transmission in a healthcare setting remains low, we all agree that we must preserve the integrity of the healthcare system. I therefore call on Doug Ford to own up to his mistake and put a moratorium and block any suspension or termination of any Ontario healthcare workers. Respect the choice of our frontline heroes and do not permit the collapse of Ontario's healthcare system. Thank you very much. We will now take a few questions. We'll go first to the reporter joining us here in Victoria Park. Welcome.
Reasons for that, my main reason for maybe being more vaccine hesitant, I just personally want to see more outcomes, see how it ends up trending. It's very new. I'm not saying I would never get vaccinated. That's just my comfort level with vaccines.
And so you say you'll be terminated as of midnight tonight?
Tomorrow night, Thursday night.
Tomorrow night, sorry, if you don't get vaccinated, is it worth the risk of losing your job?
I am standing up for my choice. I do not want to lose my job. And I don't believe there's a reason that any healthcare workers, there's not a reason that one of these staff members need to lose their job. We have protocols in place to keep our patients safe.
Can you describe why you're hesitant to take the vaccine?
I don't really want to go into that today. That's a personal choice. Just as somebody who has chosen to take a vaccine, that is their personal choice. Okay.
So you don't doubt the science behind it?
I'm not refuting the science at all. I'm actually waiting for more science to come out. And as we know, we have a lot of technology and things keep improving and tweaking as we get more information as well.
What about the argument that by not being vaccinated, you're putting other people's health at risk?
Where I work at LHSC, even before COVID, we have an excellent infection control program. We have routine education sessions on it. We have iLearns on the internet for that. We have a system that works before COVID, during COVID.
So you're following all the protocols?
Follow all the PPE. Because I'm unvaccinated, I test 3 times weekly, which is over and above what Dr. Karen Moore has recommended. So I go in knowing that I'm safe going into work. Thank you.
Sorry, I didn't catch your last name.
Davis.
Davis, okay, thank you. First of all, so how many healthcare workers in London, or at least an LHSC, would be in the same boat as you as far as facing termination tomorrow?
You know what? I don't know that. From numbers that we've been able to put together as a group, there would be hundreds within London.
Okay. Now, you just said that the system you had in place at LHSC had been working before COVID, and during COVID. I guess earlier in the pandemic, a lot of fairly major outbreaks were happening at LHSC facilities. If the system was working before, how do you explain those outbreaks?
Early on, we were lacking some of the PPE. The government didn't have us provided with what we really needed to have. And I think the pandemic came on so quickly, we've been learning actually as we went along. Apart from that though, Brian, we've always had really good infection control, so I know how to protect my patients. With the PPE, masking, hand washing, now we've added on social distancing, we wear face shields on a regular basis.
Is it difficult to be on the opposite side of public opinion?
Do you know, I don't know why it's an opposite side, actually, to be honest. I think we've had a lot of rhetoric that has come up, and I think that's where a lot of the fear, maybe for coming out and saying that I have chosen to vaccinate, because automatically with the labeling that we've heard in our own, we're told to do the right thing instead of do what's right for yourself. And if you choose not to vaccinate, again, go back to the Ontario Health, the doctor, Dr. Moore, has said, if you choose not to vaccinate, here's how you will stay safe. Here's how you will keep your patients safe. Thank you. Oh, yes, of course.
Akitel will now take questions by Akitel. Thank you very much, everyone.